Seventh grade? Okay. What about you, Angelina? You guys are also, feel free to unmute yourself too. It's really not a big deal.
I'm in sixth grade.
Sixth grade. Perfect, perfect. All right. So we're gonna go ahead and get started. Okay. Can you guys see my screen? Yeah? All right. So this is called case-based learning. Okay. And so what we're gonna do is we're gonna have a patient that's essentially coming into the hospital, and we're gonna pretend to be the doctors. Okay. And so as the doctors, our job is to try and figure out what's going on. All right. So the first thing we're going to do is we're going to meet our patient and get a little background on her. Okay. First things first. So Emily Smith is a 7-month-old girl brought into an outpatient pediatric clinic by her parents. They report that Emily has been having fevers. All right. So from this, have you guys ever had a fever before? Yeah. Yeah, right. So what do you guys think are like causes of fever? If you think back to when you've had it, what can sort of cause a fever in terms of like what kind of sicknesses? And it's okay if you don't know. No idea? Okay, right. Think about like the flu. Have you guys ever had the flu? Yeah, the flu, you could get a fever with the flu, you could get a fever with COVID-19 nowadays, right? An infection or a virus. So something like that could give you a fever. Okay. So now we're going to keep going forward. All right. So history of present illness. So I'm going to go ahead and read this to you guys. Just listen along, follow along, and then we'll break it down afterward. Okay. So Emily's mother reports that Emily was well until 3 days ago when she became more irritable. Emily has been crying more and is not as consolable as she normally is. Emily used to sleep well through the night, but has been awake and fussy for the last 2 nights. 2 days ago, Emily's mother noted Emily was warm and took her temperature. It was 99.7 degrees. Her temperature has been as high as 103. It comes down a little when Emily is given acetaminophen, which is just a fancy word for Tylenol, right? So when she's given Tylenol, her fever goes down. Emily's mother says that Emily has not been eating well or as well, but does still drink milk. Emily has had one wet diaper in the last 12 hours, and Emily's mother thinks that her urine smells quote unquote different. Emily's stool has been normal, so her like poop or her bowel movements have been normal. And yesterday she threw up twice. She threw up once today. So there's a lot of information in there, right? So what do we know from this? Can you guys just sort of like shout out what's sort of abnormal? What things are sort of like radar, something's wrong? Feel free to unmute yourself. It's all good. You guys can. Chat, there's a message in the chat. Not eating well. Yep, that's one thing. Angelina, any ideas too?
She threw up like 3 times.
Yeah, right. Normally that if you're healthy, feeling good, you're usually not throwing up. Agreed? Something's wrong there. What about the 103-degree temperature? Is that normal? No. Do you guys know what a normal temperature is? This is sort of like my trivia question of the day, right? So your normal temperature is about 98.6 degrees. So her temperature is really high, okay? She's also been fussy and not sleeping well, okay? So if you're not sleeping well, you're not feeling well, something's going on. Agreed? So let's see if we can find out a little bit more about what's happening with, oh no. Let's see if we can figure out what's going on about Emily in this case, right? It's just a little patient history. So this really isn't going to tell us much, but basically she was born, no complications with the birth or the pregnancy. Both were discharged with no problems. She did have one ear infection 2 months ago. The infection was successfully treated with antibiotics. She's up to date on her vaccines. All right, it's nothing super big there. So now we're going to look at this, and this is going to give you like some big fancy words, but we'll just sort of break it down. So her dad has seasonal allergies, right? So if you guys ever walk outside in the spring and your nose starts to run or your eyes get puffy, right? That's like seasonal allergies, the pollen, stuff like that, right? And then her paternal grandfather had an MI, which is a fancy way of saying a heart attack, at the age of 76 and has hypertension and type 2 diabetes. Her maternal grandmother has osteoarthritis and hypertension. Okay. So do any of you or either of you know what hypertension is? Any idea? It's okay if not. Yeah, right. So hypertension, if you think about your heart, right? It pumps your blood, right? And you think about your blood vessels, okay? So your blood vessels are so small, but if there's so much blood trying to force through the small blood vessels, they get strained, right? It's a lot of stress on them, and that's not a super good thing. So that's what hypertension is, okay? So that's an issue that can sort of be related to your blood, your vascular system. In terms of osteoarthritis, if you know someone who might be a little bit older, right, and their joints hurt, right, that's sort of arthritis, right? Because what's happening is as you get older, your bones start to rub against each other more, and that can be really painful. Okay. So those are just some fancy words to sort of figure out what's going on here. All right. Nothing super big to take away from this. Social history, again, nothing big, just she's a normal, healthy baby. Okay. That's all that we need to know there. Now we're going to look from head to toe. We're going to examine and figure out what's going on, right? So the first thing we note is her dad says, you know what, she's been a little less active than normal. Okay. Do you guys have any idea, if you remember back to that like second page about, she threw up and all that stuff? Why might she be a little bit tired? Any idea? Have you guys ever not slept for like 2 straight nights? Right? Maybe. You're probably pretty tired after that, right? Or if you don't eat a lot for breakfast, you get tired, right? So she's not eating well, and she's also, not sleeping well. So she's going to be tired. Okay. So then we're going to look at her physical exams here. So do you guys notice any numbers that are a little bit off? And again, feel free to chime in. So these are Emily's numbers, and these are the normal averages over there. Do you guys see anything that might be a little bit off? And it's okay if not. Angelina, any ideas? No? Aubrey, any ideas? Are you typing? She's typing. Blood pressure. Perfect, right? So her blood pressure, is it a little high or a little low? What do you guys think?
It's a little low.
Perfect, right? It's a little low, right? And so again, blood pressure, and whenever you see like the word blood and that sort of stuff, think of the heart, okay? So if you just think of the heart, so maybe something's wrong with her heart. Another thing I see is her respiratory rate is a little bit high, right? So in terms of breathing, what organ is responsible for breathing?
Your lungs.
Your lungs, okay? So maybe there's an issue with her lungs, right? We look at her temperature is also a little bit high, but we sort of knew that, right? A fever, you'd have a high temperature. And then her weight and her height, they're a little bit high, but again, that's just sort of like a growth scale. So nothing crazy there. So then we go and we're going to look from head to toe, basically. So we start with the head, and I'm not going to read all of this because there's a bunch of big words that aren't important, but her head exam is normal. Her eyes are normal, except for she doesn't have tears when she's crying. Okay, so interesting. Her ears are a little bit tender if you look. I lied, they're not actually that tender. Never mind, they're not tender. Her ears are normal. Her throat, tongue is dry, and the roof of her mouth doesn't have any saliva, right? So if you just think about your tongue right now or like your mouth, you can feel the saliva, right? She doesn't have that, right? So that's not normal. And neck, normal, okay? So we'll keep going down. Her heart appears to be pretty normal, right? It's beating normally. There aren't like abnormal like sounds or pulses. Her lungs don't sound bad. Like if you've ever had like pneumonia or something before, you know how you can get wheezy like, right? Not an issue with her. Her abdomen, again, normal. So when the doctor touches her belly, there's no pain. Now this next one, the GI tract, if you guys think on your back, if you take your hands to the back of your rib cage back there, right? That's what's called the costovertebral angle, okay? And there are two organs, one on each side that lay back there, right? What are those organs called? Take a guess. There are two of them, if that helps with anything. Two. Any idea? That's okay if you don't have any idea, right? So it's your kidneys, okay? So right there, when they're touching her right kidney, so if you put your hand back there, it's tough to feel, but that's where your kidney is, okay? So she's got some tenderness to her right kidney, okay? Do we know what a kidney does, right? A kidney is like a big filter system, right? So if you think of all the like excess gunk and stuff that can sort of run through your body, run through your blood, the kidney filters it out and then it creates your urine, okay? So that's what the kidney does. So she's tender over the kidney. When you touch the kidney, what do you think could be wrong with the kidney? Any idea? No idea? That's all right, right? Something's wrong with the kidney. Maybe an infection, maybe it's like bruised, maybe something's broken or there's kidney disease, right? Just anything could be possible. The skin is normal, neurologic exam is normal. All right, so we're gonna keep going. So next thing that we're gonna do is we're gonna take her blood and her urine and try and figure out what's going on. Sound like a plan? So if we look here, her WBC count is high, right? And her WBC count or WBC is white blood cells, okay? Do either of you know white blood cells do? Have you talked about it in school? It's okay if not. Any ideas?
Do they like fight away like the bad stuff?
That's perfect. That's exactly what white blood cells do. And the way I like to think of your blood, so you have two types of cells, right? And they're both colors, so that makes it easy. So your blood, normally you have red blood cells, which is why your blood is red, right? And that carries oxygen, okay, to your muscles and everything like that. Then you have white blood cells, and exactly what you were saying, they fight off infection or bacteria, okay? So if you have extra white blood cells, that's basically saying somewhere in your body there must be a bacteria or an infection, okay? So knowing that, we're going to keep going. And we look at all these numbers here. Again, these numbers aren't really that important. There are a few abnormal ones. We're not going to worry about it right now. Now we're going to look at her urine, okay? We notice this is sort of the big one, the clarity in her urine. It says it's cloudy. So what do you think could be causing that? If your urine's cloudy, just in general. Right, so if your urine's cloudy, there's something in there that shouldn't be in there. So those kidneys that are those big filters, right? They must not be working quite right because your pee should be like clear, like you should be able to see through your pee, and right now she can't. Okay, so this is saying something wrong is or something else is coming out in her pee. And if we look at this next slide, this is sort of like a urine microscope, so they're looking at the cells in the urine. And if you look here, the WBC, the white blood cells, are high in her pee, right? And so that's probably going to indicate that's sort of what's making it cloudy, okay? So going through all of this, right? If we just sort of recap, okay, we have she's a 7 month old girl, okay. She presents and she's been throwing up, tired, not eating well, and upon she has no known like history of any of this stuff. Upon physical exam, right, the big finding was that tenderness of her kidney, right. And then in terms of looking at her blood and her urine, we got excess white blood cells in the blood and excess white blood cells in the urine. Okay. So using all of that, what do we think could be happening here? Any guess? And it does need to be like a specific thing, just like in general. What do you think's not working quite right? Any idea, Aubrey? No idea. Angelina, any idea? No idea. Right. So in this case, it's probably the kidney that's not working right. Right? Because if we're having issues with the pee and stuff, it's probably the kidney. And so that's exactly what's wrong here. And this is a big fancy word, pyelonephritis, which basically just means that she has an infection in her kidney. Okay. So long story short, she had an infection in her kidney, which was why she was sick. They gave her medicine and she started to feel better. Right. So all those symptoms subsided. So I know that was a lot of big words and stuff that you guys haven't covered yet in school, which is perfectly okay because you guys are in 6th and 7th grade, right? But if you think about it, right, when we come into sort of med school, that's sort of what we're doing, right? It's sort of like a puzzle. I don't know if you guys like math. Do you guys like math? No, I see a no. I see two no's. So I won't use my math example, right? But it's like, do you like puzzles at least? Do you like okay, right? So it's like a puzzle, except instead of like you're trying to make this picture on a cardboard box or whatever, what you're doing is you're helping a patient, right? You're helping a person. So that puzzle is the person. And so what you're doing is you're trying to find those different pieces of the puzzle. So you're trying to look at the blood, the urine, feeling all of the organs and stuff like that. And then we're trying to make a picture of what's wrong. I don't know if that